Finally.
Finally. Yeah. I think we're live na, no? Okay. Let me check it on my page. Okay. Magandang umaga sa inyo. Magandang umaga sa inyo dyan. This is Dr. Jun Reyes. Um, I will, ang host natin ngayon, ako ang host natin ngayon. I'm gonna introduce Miss Grace Brokaw. She's an excellent physical therapist, autism specialist din siya, and also an entrepreneur. And she'll be talking about fasting, low carb, and diet. Yan. So, yan si Miss Grace Brokaw sa mga viewers ng Dr. Jun Reyes, PTDPP. Maganda umaga sa inyo dyan.
Hello, Doc June. Thank you so much for this opportunity.
You're welcome.
Medyo natagalan.
Yes, alam nyo, it's an impromptu. So I'm really excited na makausap kita about this topic about lane to fasting.
Lane to health and weight management.
And weight
Yes.
management. Yon. So yung introduction ko, you're an expert sa of course you're a physical therapist. So ano yung relationship ng wealth, I mean health and weight management sa physical therapy?
Yes. Let me introduce my first. As I've said, as Dr. June, thank you so much. I have started this lane. Actually, along the process, I was just looking for something that could slow down aging, all the illnesses. Because remember, when we see may mga patient tayo, I'm gonna talk in Taglish because I have followers in, here that could not understand Tagalog. So I'm gonna talk in Taglish. We Isn't it that when we treat a patient, Dr. June, we will for years and years, let's say joint pain, we do the exercise, there's always an inflammation. Pag may nakikita tayong pain, no? Pag may pain, there's an inflammation. And as a therapist, I've been seeing it for 25, almost 28 years. So magkakaalaman ng edad dito. So, alam ko mas bata ka. Dr. Jun here is, I think, we graduated same school, right? In Emilio Aguinaldo College. And I'm older than you. Maybe just 2 to 3 years,
Yes.
right?
Probably
So,
younger than me.
ah, so anyway, so I always see that if there's a pain, there's always an inflammation. And I've wondered where this inflammation coming from. And sometimes when there's an inflammation, may trauma, no? Na let's say ankle sprain, we've seen a lot of patients na ankle sprain, knee joint, there's always a trauma behind it. But there are people na there's no trauma, but then there's an inflammation. So along the line that I was looking for something, and I studied a lot of what is causing inflammation, and that's the reason why I have the what we call it the functional medicine. I'm studying functional medicine. So that is the study of why we get inflamed, why we get sick, why we get old, and why we get diabetes. And so nag-connect na yung I just put the dots, together, and understanding why is there an inflammation, and true knowledge of what it is causing the inflammation, we could also help our patient. We do the exercise because we're physical therapists, but sometimes there's a missing link. And that missing link is the nutrition. The lane means lifestyle change. A is autophagy, N is Nutrigenomics, and E is exercise. So para ma-treat natin yung buong pagkatao ng patient natin, I put them together. Like, there's a science behind lifestyle. We're doing it when you diet. May mga lifestyle changes tayo.
Yes.
But then the new one that I understood is the autophagy. So i-discuss natin isa-isa yan. We were gonna discuss one, the lifestyle, the autophagy, the nutrigenomics, and the exercise. So you
Awesome.
have some question before I
I
proceed?
I agree with that. Combination of lifestyle change, like basically losing weight. It's more about diet. It's more about a combination of exercise. It's 80% lifestyle and 20% exercise. So
Yes,
that's a good combination. You're gonna be talking about, a combination of what's that, autophagy,
the lane, the
the lane.
autophagy. So we will do it one at a time, Doc June.
Amazing. So yeah,
Okay.
I'm
Yes.
excited
So
to learn more about this.
yes, we'll start with the lifestyle change. Ano ba yung lifestyle change? These are the behavior modification or habit changes that encourage positive changes in your life. These are fundamental components to any wellness program. Examples of lifestyle habits includes your sleeping patterns, your eating patterns, even dealing with stress, yung gratefulness. So I'll discuss kung ano in really like, because this will just be the introduction of Lane, no? So Lane is like, as I said, the lifestyle change. Ano ba, paano ba tayo magkakaroon ng lifestyle change? One is we have to make sure that we have a quality life. Quality means, or quality in, we realize that we have to have some small changes to have a big impact. So, ano ba yon? Yung we have to learn how to read labels. Sa pagkain, we have to start learning what's the difference between organic, non-organic, ano ba yung mga pagkain na maganda, ano ba yung mga pagkain na non-inflammatory, inflammatory, kasi we're gonna focus, let's say, we're gonna focus on a patient na masasakit yung mga buto-buto, no? The joints. So when I'm treating a patient, aside from exercise, I also included an educating this patient about nutrition. Ano ba yung mga food? What are the food that's inflammatory? I start with, when you cook, what's the first thing that you put in your pan? Isn't it that it's oil, no? So I educate my patient about the types of oil that's inflammatory. Inflammatory is canola oil, vegetable oil, because it has omega 6. So when you tell your patient, can you at least change the oil? Let's do um, coconut oil, olive oil that has less inflammation to your body. So things like that, and then you have to, and then get so excited, and then can you please print me a copy of inflammatory and non-inflammatory? So I would have already, print. I would print it, and then just add additional knowledge, and they get so excited. And you know what? As soon as I started doing that, it have helped the pain. It had helped the inflammation. So that's the missing link doon sa mga therapists na nakikinig, that you have to educate this patient na kaya namamagay yung mga joints nila is not because of the exercise, because sometimes we always get blamed. Oh, I exercise and I'm so sore. But then when you ask the patient, what did you eat last night? Oh, I ate so late. I ate this pizza and lots of chocolates and ice cream. And then yes, and that's very inflammatory to their joints. And the following day they were so hungry, and so they eat again, and so they get so inflamed, and then they go back to therapy the following day, and they're so sore. So one thing is just to educate the patient. on the nutrition. And also avoid processed food. Yung highly processed food, such as the rule is like, when it's God's made, it's good. When it's man
Right.
made, it's bad.
I go back to.
Yes.
I remember you mentioned about canola oil. So
Mm-hmm.
back then I was using canola oil. I just researched. Oh, they said it was really good, but I found out that canola oil is high in anti-inflammatory component on that using canola oil. So now, what would you recommend? You mentioned olive
Coconut oil is good.
oil, extra virgin
Olive oil.
yeah, those are
Yeah.
your recommendation to improve or what we call an anti-inflammatory oil or
Yes.
anti-inflammatory food. Yeah,
Yes. Yes.
good.
So yes. So another one is avoid processed food. You have to learn how to, when you have a lifestyle change, you have to learn how to read the labels. If you cannot, the rule again, if you cannot pronounce it, if you cannot recognize it, and if you cannot read it, that's the chemicals. So
Yeah,
just the basic, you have to learn how to choose basic food. So food like, if you're gonna go to groceries, the least maybe five ingredients in that food would this be the best. Now if you have a long list of ingredients of that food, that means it's very high processed foods. So high processed foods is very toxic to your body, so that means it is gonna make you inflame. And not and when you're inflamed, when your heart is inflamed, you have chest pain. When your brain is inflamed, you have a brain fog, and your lungs is inflamed, you can't breathe. And when it goes, the inflammation goes to your joints, it's the joint pain. So especially nowadays with this pandemic, the COVID is really a high inflammatory reaction. And that's the reason one. Another thing that I've learned is the second one that we're going to discuss with this autophagy. This is studied to help manage, we can't say it cures or treat, but it manage the management of this COVID, because it's more of inflammation. Your body is inflamed. So little things like this is very important. The nutrition, yes. And also, when you do this, you have to practice meal prep. We have to encourage our patient or everybody that's listening to really cook. Why? Because when you cook, you can control the ingredients that you put in your body. And a lot of times, like our patients or our friends will say, I don't have time to cook, but they have time to watch a movie, 3 hours of television. So just try, slowly. That's the lifestyle change. You have to change your lifestyle change. You have to change your style of life, and that way, if you really is um really passionate on improving your health, you have to know your why. Why are you doing it? You go back to why. It's just like a business, right? Dr. Junior, a business entrepreneur too. You always, when there's a hardship, you always go to why are you doing your business? Why am I dieting? You go back to your why. I want to be healthy. Okay, if you have some comments, guys, comment below, what is your why? Do you want to be healthy? Do you want to look young? Because this lane is an anti-aging too, so that's a good note there.
wow. I'm
All right.
learning a lot here. Yeah, so the anti-inflammatory food, your lifestyle change. Yeah, yeah.
Yes, we have some people commenting there. I think they're your followers. Hello, Meljen, Virgie, and Nelle. Hello, hello. Thank you for watching.
To ask questions, we have an
You
expert.
can ask questions,
Yeah,
guys.
ask questions.
Yes, yes.
If I can answer the questions, I'll answer it for you. And then our expert guest here, Miss Grace, she is amazing. Yeah, knowledgeable.
Thank you, thank you. And so you are. Okay, so going back to lifestyle change, marami pa to. So hindi lang not only the food is, you know,
So,
making our joints or
Rose,
body.
question. So,
Doc June,
yes.
he said we don't hear your audio. That's our problem a while ago. That's why we can't.
Okay. Yeah. Maybe I was. Yeah. I'm sorry. We're having some technical problems. So you can hear Grace, but you can Miss Grace, right? All right. So I have a question. How many times do you eat a day? Do you recommend fasting? Do you recommend 5 times a day or small meals? How do you uh how do you eat?
Yes, that's actually our second topic, the autophagy. So before we go and discuss the autophagy, I'd like to also finish the lifestyle change. So that's the nutrition. Another thing that makes us sick is the stress. You have to determine what's stressing you. Now, aside sa food, ano ba yung linalagay natin sa katawan? You have to identify what is making you stress. Ito bang panonood sa television? The news stressing you? Then turn that television off. Is your family stressing you, or your friends, a certain friends is stressing you? So, you know, avoid them. That is because, when you are stressed, you are you are inviting these hormones that could make you gain weight, yung cortisol hormones, yung kasi yung sa pagkain, you are actually increasing your glucose, no? Pag tense ka, you tend to really gain weight. So sa mga nanonood, when you are stressed, think that I gotta slow down, I gotta breathe, relax, kasi tataba ako, no? I'm gonna gain weight if I'm so stressed. So that's another one. And then pay attention on when you eat, on why you eat, where you are, and then try just to enjoy life. And one thing that I've learned from a lifestyle change expert that I interviewed, I had a podcast, and when I interview, I learned to is from Dr. Agtarap is journal. You have to write. You have to be always thankful every day. Meditate. Write a journal. Um, write a journal, and always be thankful and don't forget to pray. So we're gonna go to your question and answer that question. So how many times do you eat a day? So this is the main protocol. This I have to do the disclaimer. This is not advisable to everybody. But if you are wanting to improve your health and you don't have medical, issues, pretty much you're healthy, and then you just want to lose weight, the main protocol that we're discussing is really is working, and it's back with science, each of one. So one is, the autophagy. Yung A ng lane is autophagy. So the question is, how many times do you have to eat? So that's where the autophagy is. We're going to discuss autophagy is the body's way of cleaning out damaged cells in order to generate newer, healthier cells. And auto means self, phagy means eat, right? So when you do autophagy, naririnig na nyo na sana siguro yung intermittent fasting. And a lot of us are very familiar with that. So when you do intermittent fasting, it stimulates your autophagy. That's the one that when your own cells eats their own self, right? So paano nangyayari yan? So when you don't eat, okay, when you eat twice a day, and sometimes, I have coaches because I have this training by Dr. Rojo. I know a lot of Filipinos are following Dr. Rojo, the diet doctor. I did the training under her, and I've learned a lot. So when you do intermittent fasting, you are stimulating the autophagy, the self cleaning. Siya yung parang janitor ng katawan natin. So
Mm-hmm.
the reason why we're not cleansing is that because we eat a lot. We are eating 5, 6, 7 times a day. And I'm guilty, right? Because at school, your mom tells you to eat breakfast, and then you eat breakfast, that's two, snacks, lunch, snacks again, and then dinner, and then when you go home, you eat those seven.
Yeah.
So when we eat too much and when we eat a high carbohydrate, meaning those bread, those rice, we tend to overload our liver. And there's no way to cleanse our body. So, ang recommendation, if you are healthier, is to skip the breakfast, or move the breakfast later and move the dinner earlier. And that way you have 16, you could start 14, 16 to 18. They said the 18 hours of not eating, you are allowed, by the way, to drink water, black tea, unsweetened coffee. That will not break the autophagy. That's the time that you kicks your autophagy, meaning kick-cleanse na yung body mo. So
Yes.
that's the
Right.
yes,
Right.
yes. And the interesting there is the autophagy. When you stimulate that one, when your body is into autophagy mode, that's anti-aging. Kaya bumabata ang itsura ng mga nag-intermittent fasting. Their skin are getting flawless, they're losing weight because when 18 hours of not eating, the body will tend to find a source of energy. And since there's no food, walang food, so they see your fats. Oh, yung pagkain, kainin natin yung fats mo.
Yeah. Yeah.
So in that mindset, when you're losing weight, keep that in your mindset that after that would keep you, disciplined from not eating a lot kasi naisip mo, sige, I need to eat, I need to be in the autophagy mode. So, gagamitin niya, it will use your stored fats as a source of energy. So, you will be amazed that you will not be hungry and you have a lot of energy and you'll have a lot of focus too. So,
Grace, I
there's
have a
somebody,
question. With with patients with diabetes, can they do
autophagy or intermittent fasting.
mhm,
That's where the coach comes in because hindi basta-basta pwedeng mag-diet ang diabetes. And that's where are trained. There's a diet doctors or coaches. We are trained to specifically personalize the we don't call this a diet, it's like a nutritional recommendation to diabetes, but there are some pre-diabetics that are doing autophagy, and there's a lot of stories that, and you could follow Dr. Fong, it's reversing diabetes, and
yeah,
this is how powerful it is. But there are studies too that autophagy can also
reverse?
affect the tumor growth. So you really have to be careful. So that's the reason why you have to find a coach like Dr. Rojo that like me, and I have a lot of classmates. We're at 100 plus that Dr. Rojo trained, and it's not there's no stopping learning.
Yes, learning is, that's the best. To learn more about your health, to learn more about how to improve your condition.
Yes, yes. Hello, Virgie. Sabi ni Virgie, naoperan po ako last December 20 until now may pain. Joint pain, tuhod, legs, and nawawala ang pain. So, yes po. So, just be careful, the lifestyle change, the autophagy, and next, Dr. June, is what we call as nutrigenomics. Ano ba yung nutrigenomics? Ito na yung parang bago kasi the thing with diet, it's just like kumbaga, it's been so used, and a lot of these diets are not working. That is because most of us are different. So it should be individualized, and individualized nutritional focus. No? So what is nutrigenomics? Nutrigenomics is the study of the effects of food and the food constituents on the gene expression and how genetic variation affect the environment. So ngayon, it's very a huge term, but I will make it clear. I will simplify it. Isn't it that Dr. June, okay, when your dad is diabetic, okay, my dad passed away from heart attack. So every time I have a chest pain, I get, I get scared because genetically you can be like your parents. But nutrigenomics is the way I explain nutrigenomics is that we can change it now. Your genes is not your destiny. And that's the new science now. And I am so excited because of this knowledge I can impart or give back to the community sa mga taga Pilipinas. I'm like Dr. June, I want to pass forward my blessings to Philippines
Yeah.
by educating people. That's the reason why idol ko to si Dr. June. I follow Dr. June when I was just so scared talking to a live.
Uh,
And I think years and years ago. So so this knowledge, the nutrigenomics, is just simplifying that you can change your destiny. Your genes is not going to dictate your destiny by changing your lifestyle again, practicing, exercising, and controlling what you put in your body, including the chemicals, the lotions, kahit yung mababango, the lotions that's really so smells so good, but when you look at the label, it has a lot of chemicals. And mind you, the skin is doesn't have a filter like when you put something in your mouth, may mga enzymes tayo na nag take care ng mga toxins. But when you put your lotion, anything, perfume directly in your skin, they said, don't put anything in your skin that you cannot eat because there's no barrier, there's no enzyme. It goes directly to your body. So yun ang babaguhin natin. So in going back to nutrigenomics, we can change our genes code by simply putting the right food, the less toxins in your body para hindi kayo mag-inflame. So your joints will not get inflamed. So we can change it now. So, and I got so excited because, wow, this is amazing. If I change my lifestyle, if I change the food that I put in my mouth, though sometimes I still get, I love to eat, If
yeah.
I just, slow down the rice, especially sa mga Filipinos, we eat rice. Did
Yeah.
you know that rice is very inflammatory? And it converts when you eat it, it's a carb, but when it's in our body, ang code niya to our genes is inflammatory. It stimulates your glucose, and then it kicks your insulin, and thus that you will gain weight and gain and joint pain and everything. So lessen your rice.
Right.
If you're Filipino, lessen your rice. I have some classmates that doesn't eat rice at all, so I
Uh,
still eat a little bit. So it takes time. For those who are listening, my American friends, eat less bread, processed bread,
okay.
pasta, but eat more protein, whole food. Like, did you know that I was trying to avoid lechon
Mm,
because I thought that was really bad in cholesterol. It so happened that it is actually good for your leaky gut. Ano ba yung leaky gut? Yan yung damage na gut mo na kung saan kaya ka nag inflame. So I'll discuss it. I have I have as I'll discuss it on the next topic. I don't like to overwhelm you. So
Yeah.
that's the nutrigenomics. Overall, we can control our destiny by allowing ourselves to heal.
Ang galing. That was amazing. Ang galing. Alam niyo,
Thank you.
sa mga viewers ko dyan, Dr. Jun Reyes, talagang napaka-importante nito. It can change your lifestyle and also your uh, genetics or genomics. So you can change it. You can minimize the risk of having heart problem, diabetes, combination ng education, learning. Yan ang pinaka-importante. Learning from Miss Grace. She's also a physical therapist, a coach. It's yeah. So Miss Grace, yung mga lifestyle changes, yung mga sinabi mo, yung intermittent fasting, and you can avoid condition like diabetes and other disease. Um, ano yun, i-summarize mo lahat-lahat. Ano yung mga dapat kainin, ano yung mga dapat gawin? Summarize.
Okay. So one is
Tagalog.
let me just there's a question, Doc. Let me just entertain this one. Is that okay?
Yeah.
Okay. There's a question here na operahan po ba ang sciatic nerve pain? Answer that, Doc John. so so your question is to summarize it, okay? So
Summarize it.
when you want, yeah,
Yeah.
go ahead.
I'll answer that question. The sciatic nerve. We don't usually. I don't recommend to go to. You start with conservative treatment. If you have sciatica, you have to know the diagnosis first. Is that yung sciatica ba is secondary to disc herniation, or ang sciatica ba is secondary to stenosis? So we have to be specific kung ano yung diagnosis ng pasyente. So number one, identify the diagnosis, ano yung nagkakos nun. Number two, try to do stretching exercises. Watch my YouTube or follow me sa Facebook page ko, and I'll show you how to do your exercise based on your diagnosis. And also lifestyle changes, anti-inflammatory. Sciatica is a form of inflammation of the nerves or inflammation of the big nerve. Um, Lifestyle changes, anti-inflammatory diet, the lane, uh, like just what we learned from Miss Grace. Amazing topic ngayon. Yon, it's gonna help your sciatica. I guarantee you that.
Yes, a lot of this nerve pain. There's also here a question. There's a pain. I'm gonna translate it in. There's a pain in the back, and it goes to the uh, ankle. Like there's a numbness. Most of these guys, when there's a numbness, it and it coming from originated from the back. It's the back pain with a nerve impingement,
Yeah.
yung sciatica nga, kaya sciatica, yung, that's a type of nerve that's been impinged ng mga tight muscles. So that's where the exercise, that's the role of being, the therapy is to stretch that muscle and then do a lot of aerobic exercises. Aerobic exercise improves your blood flow. And then, kung may mga impingement, yung usually herniated disc, that's the thing that when you have a herniated disc, it also compress the nerves that supplies your legs. Kaya ho, it goes to your legs. So that's the reason why it sometimes radiate to your legs. Yung pumupunta dun sa talampakan. So yes. So ano nga yung question mo, Doc June?
It's all
Nina?
yung from how do you call that? Lifestyle changes. Ano yung dapat gawin? Number two, fasting or autophagus. I'm not sure
Mm-hmm.
if I'm saying it right. And then
Autophagy and
autophagy
nutrigenomics.
and
Yes. All right.
nutrigenomics.
So
So it's a
I
combination,
thought
right? So,
yes, it's a combination. And this is actually, personally, I put this together. That this is so special to me because I was just trying to actually I reached out to this doctor in the Philippines, and then I invited this doctor, and on that process I have gained a lot of weight through COVID. And then I was just looking, oh, okay, I tried this diet and that. It works sometimes. I did exercise, but when I did the exercise, I gained more. Isn't it that when you exercise tapos nag-stop ka, why is it that you gain more weight? And I can explain that too in another episode. So the lane is, I personally put this together because I realize I do it for myself first, and I have a group. It's called Lane to Weight Management. I can put this down here and share it to Dr. June. Lane to Health Weight Management. Just find it in Facebook. I created this one and I just put whatever the knowledge that I learned there. And sometimes, I'm into functional medicine. Ayun po yung parang holistic doctor na kung saan we study why we gain weight, why we get sick. And this is going to be big. It's already getting big here in America. And I think there's one now or two na functional medicine sa Philippines that's been open because I try to connect with them. Is that, this actually are parang the study of why we get sick, why we get low back pain. And this is very interesting because it's not only one that's we're doing as a therapist, as an exercise, but we have to also consider yung lifestyle change. Sa lifestyle change, ang una-una is to start, small changes with a big impact. That is one, go to your kitchen and check mo kung ano ba yung mga food na inflammatory, non-inflammatory.
Yeah.
Dun sa in my Facebook group, I have a list there courtesy of Dr. Rojo. So you have to identify kung ano yung mga food, what are your food that you're eating. And also, it's okay to get you go out and eat, and because food is about it's about information. It's about community. So when you go, you eat with your friends, and that's very important because when you eat with your friends, you're mindful, you're happy. And one thing more is chew your food. When you chew your food, you're not stressed, and when you eat, your body is ready to burn that food, and hindi kayo kakabagan. So a lot of us are getting bloated because we're eating in the I have a lot of friends, including me, here in the America. We'll rush. We don't have inday. Kami yung inday. We are the inday. Kami yung katulong. So you're lucky there in the Philippines. When I was in the Philippines, I have one personal nanny, and the rest is history. Anyway, so, and also learn how to read labels. Kung hindi nyo ma-pronounce, when you can't pronounce, you can't recognize, put it down because it has a lot of chemicals. And also avoid artificial food. You know that the rule is if it's God's made, it's good. If it's man-made and you can't read the labels, that's very inflammatory. And
Exactly.
practice meal prep, cook, give time to cooking, pay attention on the stress, eliminate your stress in life, avoid stressful people, negative people. If this news in COVID is stressing you, and a lot of us guys, we are so obsessed of identifying who's vaccinated, who's not vaccinated, and then we tend to, fight in social medias. That is putting a lot of stress in you. And when you are stressed, your immune system goes down. So that's not helping. So instead of identifying who got it, who's healthier or not, why don't you start with yourself? Start. The reason why we get sick, that's the reason why I love functional medicine, is that we don't pay attention on ourselves. Pay attention on yourself. Are you eating the right food? Are you eating the right food? Are you putting a lot of stress in your body? Because all of the stress, the food, the news, the people, is going to decrease your immune system. We've talked this a lot. When you're stressed, your immune system goes down. So also, don't don't be afraid to get out. going out improves your immune system because it releases your hormones, your happy hormones. And hello, Wilson. She said, avoid negative people. Noted po. And yes, and when you're stressed, it decreases your immune system. Another thing is supplementation. Supplementation, vitamin D. How do you get vitamin D? It's proven to help, the immune system. Vitamin D, you can get it from mushroom, egg yolk, just a little bit of milk because not all vitamin
Sunlight.
D is in there. And exposure to sunlight. Did you know that when your vitamin D is in your skin, you just need a sunlight you know, to make that into vitamin D that will boost our immune system. It's proven and studied that vitamin D can also take care of this virus and it's free, right? So,
Yes.
and also supplementation, magnesium, B12, magnesium. A lot of us are deficit with these minerals because we're not eating right, right? So, do supplementation, B12, magnesium. And that's the reason why I promote a lot of like supplementation that's been studied in my Facebook. And so those are very important because we are lacking minerals. That's one of the cause of why we get sick is we lack minerals. So also the autophagy. So the A lifestyle autophagy, cleanse your body. Stop eating a lot. Don't overfeed because you will not die if you don't eat breakfast. If you don't eat dinner, skip a little bit. Hindi ka naman mamamatay kung
Yeah.
hindi ka kumain ng breakfast, right? So because you have a lot of stored fats in your body. So the fats are not there for appearance, for looks. It should be used as a stored when there's emergency. That's the reason why may fats tayo kasi it's stored because of emergency, for emergency. Kaso, we don't have that emergency no more. We are surrounded by food. So slow down on your eating, chew your food slowly, and just enjoy it. Enjoy. There's a studies when you eat it with your family, um, most of the time, and you enjoy it with your friends. That food is gonna be nutritional. And a lot of us, when we eat a lot, our sense of taste, nagnanam na yung mga taste bud natin kasi kung ano-ano na yung kinakain natin. Sweet, salt,
Right.
yeah. So there's a study that it numbs your taste buds. So kapag kain kayo ng kain, mawawala na yung taste and you will not gonna enjoy that food. So when you
Drink
do
medicine.
autophagy,
Drink
yeah, when you
medicine.
do autophagy, you will be amazed that after I did it one time, I did 26. I did not intentionally do it. I just got busy, treating patients. I was so bubbly and so funny, and then I realized I didn't eat breakfast, I didn't eat lunch, but I have a lot of energy and I have more focus. I said, wow, but when I eat like pizza lunch, I feel druggy and I can't finish my notes. So
Yeah.
that's autophagy and nutrigenomics, control the toxicity, and we have some supplementation that's coming in the Philippines. Maybe this year, next month, that's gonna activate your body to a younger self. So watch for that. And also the exercise, which Dr. June is always talking about. So that's it.
I am so happy. Oh my golly. Uh, yes.
We
You know,
have like 84 live views. Wow.
yes.
Sikat na sikat talaga to si Dr. June.
I was hoping to get more. Maybe maybe someday. It's a big help para sa ating mga taga yung mga viewers natin dyan sa Pilipinas. Importante to yung mga messages na binigay ni Miss Grace. Napaka-importante kasi education makakatulong natin na ano yung mga dapat kainin, ano yung autophagy, ano yung um, uh, iba-ibang mga factors na makakabuti sa atin. So hindi ito nung nasa Philippines ako, hindi ko natutunan to. When I was in school, learning physical therapy, learning medicine, hindi ko natutunan to eh. Um,
Yes,
I
yes.
learned it from you. I learned it from reading books. Kaya sinashare natin sa ating mga kababayan, sa ating mga viewers, um, lane or autophagy, yung mga words like
Nutrigenomics,
nutrition,
exercise.
exercise, the right way of eating. Umpisa pa lang yan. We're just starting. So, education, we're just starting. And I'm a big fan of this. Gagawin ko na siya. I'm really excited. I'm gonna start it
Yes,
today.
yes. Yes, also, under nutrigenomics, we call it activation. Karamihan sa atin, I just want to add, um, hello from Hawaii, Elsie. Wow, we're everywhere. Actually, I put this video to on global TV, which will be watched by many from all over the world. Thank you, global TV. I'm one of the moderator. This global TV is like international viewers. So hello everyone. So I'd like to also add in why we get sick is not because of the nutrition, the deficit, is that sometimes it's what we call that's oxidative stress. Oxidative stress is when we cut an apple, it becomes brown. Now, Doc June, kung ilang taon ka na breathing oxygen, that's the reason why when you're more older, your skin wrinkles, right? Because that's the effect of oxygen. The one that makes us alive also kills us slowly, unfortunately. That is the oxidative stress. Oxidative stress, remember when we're studying physical therapy, it is linked to stroke, diabetes, and all of these diseases. And I just highlight it. I don't understand it until I learned the nutrigenomics. Oxidative stress is when you cut an apple, di ba ho, pag when you cut an apple, nagbe-brown. So when we breathe oxygen, especially yung mga runners, do you notice yung mga runners, they are skinny but they look older. That is because they have a lot of oxidative stress. And going back to the joint pain, ayan din po yung isa sa reason why we have joint pain. We have a lot of oxidative stress in our body. Now, how can you reverse that? How can you help that? That is with what we call as the nutrition, the scientific now that's coming to Philippines, the NRF2. That's the NRF2 is the pathway where you can parang you charge yourself that it decreases your oxidative stress 40% by 30 days. So yun ang new scientific breakthrough now that so I'm so excited to share that to you guys in different you can message me, I can send that information to you, but for right now I'm just gonna be just mentioning it decreases your oxidative stress, and it's all natural ingredients, it's just like a food, but what it does, it activates your body to a younger healthier you.
Awesome,
Yes.
awesome. Grace, where are they going to reach you? Can they reach you through your YouTube channel? I'm recommending to follow Miss Grace
Yes.
Brukal, and she's an awesome physical therapist, a vlogger, you name it, and an real estate agent, a real estate investor. Um,
Yes, I got it from you. I started buying houses like you.
that's
Sabi ko nga,
amazing.
yeah. Sabi ko nga, idol kita. I'd like to say hi. I'm Edith, living here in Sydney, Australia. My sister lives in Sydney, Australia. I'm enjoying your talk. Thank you so much. Thank you so much for listening. We have a lot of viewers. So you can actually find me in Grace Steadfast. My Facebook is Grace Steadfast. I'm gonna link on Dr. June's, and I also started doing YouTube, and I just have 70 followers. So guys, please like, I interview a lot of doctors, and there's the nutrigenomics there, there's autophagy video, there's the food that we need to eat or not to eat. So I just started like March my podcast, and I have just 70 subscribers. So I need you support
Please,
your followers, Dr. Jun, to subscribe.
it's a YouTube channel.
Yes.
Yeah.
Thank you in advance. And this is my website, flipyourswitchwithgrace.com.
Yeah.
Yes.
You.
Oh, we have a lot of viewers from Sydney, Australia. Get a back pain. Yeah, I think that our next topic will be back pain. I can be back.
Miss Grace, with this Nutrigenics, it can help low back pain, neck pain, almost everything, except for broken heart.
All right. So again, we don't claim it cures or treat, but knowing that the cause of most of the pain is inflammation, and the cause of it's just like a dot connecting the dot. The cause of inflammation is one of the cause is oxidative stress and the food. So if you have something that could lower your oxidative stress, then what will happen? Okay. So we cannot claim it cures or treat or decrease your pain, except for your heartbreak that I can't do. So maybe a heart inflammation it could help, but the heartbreak from loved ones
Yeah,
that's different, right?
sports.
So we also have Philippines. Yes, we have a lot of viewers. Thank you so much. So guys, flip your switch with grace.com, and yeah, that link, and you can follow me. Thank you so much. Thank you so much.
Thank you, Miss Grace. I'll talk to you soon.
Thank you. Guys, thank you. Good night.